Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. We'll be speaking with Dr. John Laird, Chief Medical Officer for Peripheral Vascular Health at Medtronic, and Terry Litchfield, President of Access Solutions and a patient advocate. They're both joining us to talk about a new national survey conducted by the National Kidney Foundation in partnership with Medtronic that uncovered a potential gap in awareness for end-stage kidney disease patients undergoing hemodialysis. Welcome to Health Professional Radio, both Dr. John Laird and Terry Litchfield. Thank you both for joining us this evening.
Thank you, Neil.
Thank you.
Doctor, if you would give us a brief look into your professional background, and then Terry, if you would tell us a bit about yourself when John concludes.
Well, thanks very much, Neil. I'm Chief Medical Officer for Peripheral Vascular Health Unit of Medtronic, but I'm an interventional cardiologist by training and have practiced for over 30 years with a primary focus on vascular interventions outside of the heart. And I've been involved with the maintenance procedures and development procedures for dialysis AV fistulas.
And Terry?
Yes, I'm a patient advocate for kidney patients. I'm one of the few people who has been lucky enough to have an avocation and a vocation. I met my husband, who was the U.S. longest surviving dialysis patient, when I was doing a master's thesis. I was in the healthcare field as a hospital administrator. And so I kept always in my hospital career was involved in dialysis, I think because my husband was on home dialysis. And after he passed away, I retired from full-time kidney care work in the vascular access field to be a patient advocate, specifically for vascular access and other kidney patient-related activities.
Now, as far as there being a lack or a gap in awareness among ESKD patients, what are we talking about as far as this lack of awareness? What is it that they're not aware of?
A number of patients haven't been educated or told about a non-surgical access. You know, they historically for 50 years, the only way you could get a fistula, which is the best way to connect to a kidney machine, was by surgery, open surgery. And if people are not performing the procedure, or maybe they may not be aware of it, they're not letting their patients know that it's an option. And so a number of patients hesitate to get any permanent access and stick with central venous catheters, which have the poorest outcomes and a lot of infections. So I think it's a problem that the patients aren't aware. They aren't being told by their dialysis providers, and it's the survey said it's not being offered to them when they go for their permanent access placement.
John, what is the reason that these professionals aren't letting their patients know about these minimally invasive procedures?
Well, I think for the most part, it's lack of knowledge about the alternative therapies that are out there, unfortunately. Just to back up a little bit, AV fistulas are created to allow for an easy and reliable access point for the hemodialysis procedures that are required to keep these patients alive. Basically, traditionally, this has been done surgically, where a surgeon will connect a vein to an artery to allow more flow through the vein so that the vein will plump up and so that it can be more easily cannulated for the hemodialysis procedure. The most common AV fistulas are the radiocephalic AV fistulas, where the cephalic vein is connected to the artery in the wrist region. That's called a brachiocemino fistula, or the brachiocephalic AV fistula, where the brachial artery is connected to the cephalic vein in the antecubital region or in the upper arm. So traditionally, this was a surgical procedure. It's the way it's been done for many, many years. And unfortunately, physicians are not yet aware of the less invasive or minimally invasive alternatives that are out there, which Terry mentioned.
Terry, this system, I think it's known as the Ellipsis System. Is that correct?
Correct.
Explain how this system benefits patients far above the normal standard.
Well, one of the things that we found post-pandemic, because dialysis patients fared very poorly with COVID infections the first time in 50 years, the dialysis population actually went down. And patients have not yet returned as they should for some hospital interventions and screening tests. Patients really are still avoiding hospitals. But what I have to say about the minimally invasive fistula creation that I hear all the time from patients is it's less interruptive. So you can go, you don't have to go to a hospital. You could go to a hospital if your hospital doctor is performing it, but you could also get it in an ambulatory surgery center or an office-based center. And it's not like an open surgical procedure where you're going to have a surgery and sutures. And literally this procedure can be performed in less than an hour. And when it's done, instead of sutures, instead of stitches, you have a Band-Aid. And so that's one of the things that's very appealing. Unfortunately, when a fistula, a surgical fistula, is created and it grows, it sometimes grows large. And there's obviously surgical scars. And for a lot of patients, just the cosmetic aspect, especially female patients, they really don't want their arms cut on. And unfortunately, even the best fistulas don't last a long time. They last a few years. And so it's that, and also the recovery. So recovering from an open surgery is a lot longer, not a lot longer, but it's longer than a minimally invasive procedure where you can go for your normal activities generally the next day.
Dr. Laird, it's my understanding that the survey also revealed that patients trust their physicians when it comes to treatment options. How can professionals engage more productive discussions with their patients about this system?
Yeah, that's really a great question, Neil. I think first off, obviously health professionals need to be aware of all of the options for AV fistula creation. And unfortunately, that's not the case today. We see better penetration with these minimally invasive procedures in certain regions of the country and in certain centers in the country, but it's not a uniform thing. And so there's clearly parts of the country and certain regions where the word hasn't gotten out. I think we, as an industry, need to do a better job educating physicians and other healthcare providers. And I think that's part of the reason why we're having this conversation today. And I think to do it right, I mean, healthcare providers have to be able to provide patients with all of the options that are out there for AV fistula creation. They have to be able to kind of outline the pros and cons and the risk-benefit ratios for these procedures. And I think there are, as Terry mentioned, a number of important advantages with the ellipsis less invasive procedure that should be presented to patients so that they are more aware.
Terry, how does this system benefit the caregiver as well?
Well, I can speak firsthand as a caregiver. One of the things the patient and their family always want is to get a good quality of life, and that means less encounters of any type. And so this is far less invasive, and it gives the caregiver, instead of having for those first few days with a surgical fistula, the arm is propped up and really not able to be used very well. With these minimally invasive, they can get back to their normal activity. I had one patient express to me they wanted hassle-free access. And it's not that it's hassle-free. And then the final commentary I have as a caregiver, my husband had one fistula that was created that never worked. And then I learned by reading some papers that, upwards 30% or so of the fistulas created are never able to be used for dialysis.
Wow.
And so he had to have another surgery. And that was crushing. That was crushing to me. And then, of course, as a caregiver, I had to take the days off. And it was, we had the co-pays and everything. We had to pay for the fistula that never worked.
Wow.
So that's how it impacted me as a caregiver, the reality of days off and lost days to doing the things that we really wanted to do.
Give us a website where we can learn more about Medtronic and the Ellipsis System as well.
Patients can go to our website, Medtronic.com, where there is a lot of materials related to the ellipsis procedure and the potential benefits of this approach to the creation of AV fistulas.
Dr. Laird, Terry, I appreciate both of you joining us here on Health Professional Radio, and I'm looking forward to another conversation with you.
Thank you very much, Neil.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. John Laird and Terry Litchfield. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.